Now, if you're watching me right now, I don't know if you're ovulating or not, but your menstrual cycle is regular, and maybe you don't notice any of these signs I mentioned about fertile period and ovulation signs, and you want to really know if you're ovulating. I'm going to mention three major ways to know if you're ovulating or not. What if I told you that you could be seeing your period every month and still not ovulating? Sounds confusing, right? Many people have this conception that once you are menstruating, you're automatically also ovulating. The truth is, ovulation and your period are not always the same thing. And if you're trying to conceive, you're trying to get pregnant, this is something you really need to understand. So in this video, I'll be walking you through real signs that your body gives when you are not ovulating. So if you're coming across my channel for the first time, you are welcome. My name is Uche Chechizendo, a clinical physiologist. Do well to hit the notification bell so that anytime I post a new video, you'll be notified. Now, let's get into business. Now, listen up. I need to get something clear. Not everyone experiences a notable sign during ovulation. While some persons, they normally notice symptoms when they're ovulating, while for others, they might not even notice that they are ovulating, no signs at all. And that is normal also, because some persons normally feel ovulation pain, while for others, they don't feel any sensation at all. Now listen up, before we get into the signs, I want to break this down quickly. Ovulation is when your ovary releases an egg, and in most menstrual cycle, only one egg is released from one of the two ovaries. The two ovaries do not follow a strict turn. In fact, it is a common myth that ovaries alternate, meaning that left ovary will ovulate and release egg this month, while the right one will release egg next month. That is a myth. Some research suggests that the right ovary may slightly ovulate a little bit frequently than the left ovary, about 55%. It is possible for an ovary, either left or right ovary, to release an egg severally, like that particular ovary keeps on releasing an egg every month. It is much possible. Occasionally, or will I say rare, for the two ovaries to release an egg the same time in the same cycle. This is what we call hyperovulation. Some persons believe that their two ovaries releases an egg every month, like the same cycle. That is not true. It happens occasionally, particularly when you're hyperovulating. Normally, it's one of your ovaries that release egg during ovulation, not your two ovaries. That is why a woman that has one blocked fallopian tube can still get pregnant, provided that the other ovary, that the other fallopian tube is open and she's also ovulating in other area. She can still get pregnant. Having one blocked fallopian tube does not automatically mean that you won't get pregnant. Just that your chances of getting pregnant is a little bit limited compared to when you have two, because you don't know which ovary will be releasing egg during ovulation, whether it's the right one or the left one. Listen up, ladies, to understand how our body works, how our ovulation works, our menstrual cycle works. We need to understand that the menstrual cycle, inside of the menstrual cycle, we have 4 phases. The menstrual cycle does not only end when you see your period, the days you see your period, maybe that 4 days or 5 days you see your period. That 4 days does not automatically mean that that is the only menstrual cycle. No, the menstrual cycle is divided into 4 phases. We have the menstrual phase, we have the follicular phase, we have the ovulation phase, and the luteal phase. Now back to the menstrual phase. The menstrual phase is your day 1 of your cycle, the first day you see your period. Some persons, it lasts from 1 to 5 days, while some persons 4 days, some persons 3 days, while some persons even 7 days. When your period begins, both estrogen and progesterone drop slow. The drops in progesterone and estrogen is what causes your uterine lining to shed. At this point, your brain releases gonadotropin releasing hormone, which tells your pituitary gland to release FSH, as follicle stimulating hormone. Now for the follicular phase uses your body up for ovulation. When the pituitary gland releases FSH, as follicle stimulating hormone, this follicle stimulating hormone tends to stimulate your ovaries. When they stimulate your ovaries, they stimulate your ovaries to mature, those follicles in your ovaries to mature. Each follicle contains an egg. As this follicle grows, they produce estrogen. What this estrogen does is that it thickens the uterine lining, that's the womb, preparing it for pregnancy. As estrogen rises to a peak level, something important also happens. High estrogen triggers the surge of another hormone, which is known as LH, that's luteinizing hormone. This luteinizing hormone causes the ovaries to release mature egg. Now, this is what we call ovulation. This is what we call the ovulation phase. After the egg is released, the egg can live about 12 to 24 hours. Then it dies off. If fertilization must happen, then the sperm must meet the egg within this phase, within 12 to 24 hours after the egg is released. Now, for the luteal phase occurs after ovulation. Now, after the egg is released, that empty follicle that releases that egg becomes what we call the corpus luteum. This structure produces progesterone. Progesterone helps to stabilize and maintain the uterine lining, making it thick and ready for implantation. Progesterone prevents the lining of the uterus from shedding too early. That is why if you have low progesterone, you might find it difficult to conceive because implantation will not happen. Or even if implantation happens, miscarriage can occur because the fetus is not well implanted. Now listen up. Signs you may not be ovulating. Now let's talk about these signs. So this is the area where you really need to pay attention to your body. And number one is irregular or missed period. Now listen up. If your period keeps on changing dates, skipping, or even not coming at all, it could mean that your body is not releasing egg regularly. When hormones are unstable, ovulation becomes irregular, or maybe it might not even happen at all. And next is no change in basal body temperature. Normally, after ovulation, your body temperature rises slightly. If you are tracking and there is no change in body temperature, ovulation might not be happening. And number three is lack of fertile cervical mucus. Around ovulation, you should notice a clear and stretchy discharge that looks like egg white. If you're always dry, or maybe your discharge is always thick and creamy all the time, your body may not be entering that fertile window period at all. Now listen up, we all know that seeing cervical mucus during ovulation is one of the signs of ovulation. But seeing cervical mucus does not automatically mean that you are ovulating. Just that sign there makes you signals your body that, hey, you are on your fertile window period. It is also entirely possible to ovulate without seeing any cervical mucus. Sometimes this cervical mucus stays higher up near the cervix and doesn't reach your pints or maybe your toilet tissues. So if you don't automatically see them and this mucus on your pints or toilet tissues, does not automatically mean that you are not ovulating. It can be near the cervix without reaching there. Some people naturally produce small amounts of this mucus. Even if they are ovulating naturally, they produce small amounts of this mucus. So such kind of people, you can't classify them as if they are not ovulating. They are still ovulating, but just that their body can't produce enough of this mucus to be visible. The fourth reason that might cause you not to ovulate is that if you are dealing with hormonal imbalance, things like persistent acne. If you normally notice persistent acne on your face, that could be hormonal imbalance. Or maybe you notice facial hair as a female around your jawline area, or maybe all over your body, or maybe experience unexplained weight gain. That can point to hormone issue like polycystic ovarian syndrome. And one of the biggest effects of this condition is that it causes irregular or absent period. And lastly, if you notice that your period is too light or heavy, a very light period might mean that your uterine lining didn't build properly. And this can be due to weak ovulation. On the other hand, heavy bleeding can also signal to your body that your hormones are not well balanced. Now, if you're watching me right now, I don't know if you're ovulating or not, but your menstrual cycle is regular, and maybe you don't notice any of these signs I mentioned about fertile period and ovulation signs, and you want to really know if you're ovulating, I'm going to mention three major ways to know if you're ovulating or not. Firstly, get an ovulation predictor kit. This is something you can easily get in a pharmacy. Tell them to give you ovulation predictor kit. I think one is either 1,000 or 1,500, depending on the area you are, depending on the pharmacy you went to. So get this test kit. This test kit works by checking your urine for an hormone called LH, that's luteinizing hormone. We all know that this luteinizing hormone is a hormone that triggers ovulation. It triggers your ovary to release egg, to release mature egg. This hormone is very, very important because it spikes before ovulation. It surges up, it rises up before ovulation. So when you use this ovulation predictor test kit, and it turns positive. When I mean positive, is you will not have any faint negative line. The two line must be bold and positive. What it really means is that ovulation is about to happen in the next 24 hours or even 36 hours. It is simple, it's practical, and honestly, it's one of the easiest way for women to track ovulation. So the only thing is that you have to test at the right time in your cycle. That is why you should know your cycle as a lady. For you to use this ovulation test kit, you must know your cycle. You must know when you're ovulating, so that when you make run this test, it can give you a clue that maybe you're about to ovulate in the next 24 hours, in the next 36 hours. You must know your cycle length. The only thing is that you have to test at the right time in your cycle. That is why as a lady, you should know your cycle length. I can't explain that in this video. Maybe I'll do another video for it. For those of you that don't know how to calculate your cycle length, if they ask you what's your cycle length, you can't tell. Some persons, their cycle is 21 days, while some is 28. For others, 30 days. So you should know your cycle length. Knowing your cycle length helps to know when your fertile window period, so that you run this test during that period to know if you're actually ovulating. Now listen, if you want something more confirmatory, not based on prediction, a proof that ovulation has already happened, then we move to blood test for progesterone. I explained this earlier on. After ovulation has occurred, your body starts producing progesterone. So when you go to a lab about 7 days after your ovulation, and they check and they see that your progesterone level is very high, is high, or maybe it's normal, the normal range is supposed to be, it clearly shows that ovulation has taken place. So this method is very, very reliable because it's not guessing. It's just like measuring what your body has already done. The downside of this is that you need to visit a hospital or a lab. It's not something that you can easily do at home with just a test kit with your urine. And the timing is very, very important. That is why I said you must know your cycle length as a lady. If you go too early or too late, it might not actually give you the correct result. That is why I say the timing is very, very important when it comes to checking your progesterone level. Now, for the most accurate method of all for checking if you're ovulating or not is by using ultrasound scan. This is usually done in a clinic, and what the doctor does is that it monitors your ovaries over a few days. They are literally watching your egg grow inside a structure called follicles. As ovulation approaches, these follicles becomes more bigger and bigger until it releases the egg. And yes, with this method, they can actually see when the egg is developing, when it's matured, and when it has been released. So there is no guessing here. That is why it is the most accurate method to check if you're ovulating or not. So if you're trying to conceive, maybe for months or even years, and you're not even sure that if you're ovulating or not, but your menstrual cycle is normal, go for follicular tracking, this follicular monitoring. This is the best way to check if you're ovulating or not. This is not guessing. It's not about counting your calendar. This is about ultrasound, going into your body, your reproductive organ, to monitor your ovaries, to know when it is mature, to know when it has released egg. And yes, I know it requires multiple visits to the clinic or lab, but this is the most accurate way to know if you're ovulating or not. Is what it, right? Now, this can be the reason why you have not conceiving, not because you're not ovulating, but because you don't actually know when you are ovulating. So if you really want to know if you're ovulating, follow these 3 major methods. Apart from physical signs like cervical mucus, basal temperature, make sure you follow these 3 methods by follicular tracking, going to the lab to check your follicles if they are mature or not, progesterone test to know your progesterone level after 7 days of ovulation, and using ovulation test kits. These 3 methods will help you to know if you're ovulating or not. I hope this video was educative and helpful. Now, if you like this video, don't forget to give a thumbs up, subscribe, share, and like. Bye.